Megan.
Hi, I'm Bella.
I'm Nicole.
I'm Noelle, and we're talking about obesity today.
What is obesity? Obesity is an abnormal increase in the proportion of fat cells. Weight gain, in which the body is moving towards an overweight or obese state, is characterized predominantly by an increased number or size of fat cells. Obesity occurs because energy intake exceeds energy output. Two types of obesity are primary obesity, which is caused by an excessive caloric intake for the body's metabolic demands, and secondary obesity can result from the various congenital anomalies, chromosomal anomalies, metabolic problems, or CNS lesions and disorders. Some contributing factors of obesity: genetic and biological factors. Estimates of obesity as an inherited problem are over 50%. A strong link between the FTO gene variant and BMI has been linked. Obesity is associated with increased circulating plasma levels of leptin, insulin, ghrelin, and decreased levels of peptide Y. Interaction of these hormones and peptides at the level of the hypothalamus may be an important factor contributing to obesity. Some environmental factors. In today's culture, there is a greater access to food, particularly packaged and fast foods, as well as soft drinks, which have a poor nutritional quality. Portion sizes of meals also affect obesity. Eating outside of the home impedes the ability to control the complications and quality of food. Lack of physical exercise. With increased technology and labor-saving devices, Americans are expending less energy in their everyday lives. Some socioeconomic status can affect obesity. People with low incomes may buy food that is less expensive, but the food may have lower and poor quality nutrition and have greater caloric intake. Low-income residents may be more likely to live in environments that do not accommodate outdoor activities. Some contributing factors continued are psychosocial factors. People use food for many reasons besides nutritional maintenance. Stressful situations may cause overeating for comfort, and the social component of eating begins early in life when food is associated with pleasure and fun, such as events at birthday parties, Thanksgiving, and religious holidays. Some cultural and ethnic factors that affect obesity may be your ethnicity. Among men, Mexican American men have a higher prevalence of obesity. African Americans have a 50% higher prevalence of obesity, and Hispanics have a 21% higher prevalence of obesity compared with whites. Among women, African American women have a higher prevalence of obesity. Native Americans have a higher prevalence of being overweight compared with the general population. Asian Americans have the lowest prevalence of being overweight and obesity.
For risk factors, genetic predisposition can play a role in obesity. Some of us just have a greater tendency of gaining weight and storing it in certain areas of our body. Sedentary lifestyle, if you're not very active, you're not balancing your intake with your output. Unhealthy diet and eating habits, if you tend to eat junk food or fast food or overeat, that can play a role in gaining weight. Family lifestyle, people who live together tend to share common diet and activity patterns, not always, but most of us. Pregnancy, some of us have difficulty with losing weight after pregnancy, so that can play a role. Lack of sleep can also cause cravings for high-calorie meals. There's also certain medications such as antipsychotics, antidepressants, anti-diabetics, anticonvulsants, steroids, and beta blockers can all contribute to weight gain. Advance in age and the hormone changes that are associated can decrease muscle mass, activity levels, and metabolism. And as Nicole mentioned, socioeconomic status also plays a role, and pre-existing medical conditions such as Cushing syndrome, polycystic ovarian syndrome, and hypothyroidism can lead to weight gain, as well as factors that affect activity levels such as osteoporosis. So for prevention, the American College of Sports Medicine recommends 150 to 250 minutes of activity per week, which boils down to roughly at least 30 minutes a day for 5 days a week or more. Also, we encourage you to eat healthy meals and snacks that are low in calories and high in nutrients, and avoid saturated fats, sweets, and alcohol. Also your soft drinks. Identify and avoid Situations that trigger overeating, such as if you're going out to eat with friends and you know you're going to overeat, don't do it so much. And monitor your weight regularly, because it's easier to make changes if you gain a couple pounds than if you step on a scale and you find out you gained 15 pounds. And finally, make a plan and be consistent.
How is obesity diagnosed? Body mass index, also known as BMI, is used to classify individuals as underweight, healthy normal weight, overweight, or obese. The calculated BMI is the common clinical index of obesity or altered body fat distribution. There's a specific formula used to calculate the BMI. Detection. BMI is used, 30 of higher is considered obese, 40 of higher is considered extreme obesity. You can also use the waist to hip ratio, waist circumference, and body shape or fat distribution. And there's two types, android or gynoid. This is a photo of gynoid and android obesity. Typically, gynoid obesity is known in females and android obesity is known in males. Evidence-based treatment and management. Exercise, weight loss of 1 to 2 pounds a week is considered healthy. Also watch your diet and healthy food choices. So you stay away from empty calories, which are foods and drinks with many calories but very few nutrients. Do behavior modification. There's also drug therapy, and they can decrease your food intake by reducing your appetite or increase sense of fullness after eating, or decrease your nutrient absorption. You can also do surgery, but there must be certain criteria to meet and you have to consult a doctor. Certain criteria can include, some of this criteria includes being greater than 18 years old, having a BMI greater than 40 or greater than 35 with one or more obesity-related complication, having an obesity-related complication, being obese greater than 5 years, having tried and failed to lose weight. An ideal candidate will have no endocrine problems, but type 2 diabetes are candidates. No psychiatric issues, so they have to be emotionally stable and socially stable, and they have to be compliant with the restrictions of surgery, so they must maintain a sugar-free diet. This is the Eat Well plate, which is an example of how much a person should eat from each food group.
Obesity affects different aspects of the patient's life. It can influence the physical aspect, which are comorbidities like hypertension and other cardiac issues. Breast and ovarian cancer, since those are due to estrogen, too much estrogen in the body, and estrogen stored in adipose tissue, which are your fat cells, and sleep apnea, because when you have too much weight, you're compressing the lungs and you can't breathe very well, especially at night. Environmental, like mentioned earlier, fast food is readily available, and we have fast-paced lives and desk jobs, which don't let us have much exercise. And Houston is really hot, so a lot of people don't want to go outside and jog and do any sports or anything like that. Spiritually, it affects you because a lot of people feel guilty because their body is the sanctuary of the Holy Spirit. So people do feel guilty that they're treating their body with such disregard. Emotional and mental depression, there's a depression and obesity cycle. People will be depressed and then they'll overeat, and then they'll be depressed because they're overeating and gaining weight, and it just keeps going and going and going. And women are actually more prone to this cycle than men are. Socially was also mentioned earlier. We tend to eat socially, and there's also a social stigma, and it's especially found in children now. These are various support groups and resources that people could utilize. On this side, there are online groups and forums, so if people can't get outside of their jobs or can't afford therapy sessions or weight loss programs, there are online options available for them. Then there's also groups that physically meet together, and this website has a few different places to meet and different therapists and things of that sort. There's the emotional overeating and binge eating support. But that's in the middle of the week. It's on Tuesdays. It is locally. They cover topics like eating disorders and obesity and mindfulness-based treatment orientation. It's a 12-week group, and it helps you distinguish between physical and emotional feelings when it comes to food, and managing the body and the bashing thoughts that you have on yourself. It's coping with cravings and how to stop compulsive eating or binge eating. And their main slogan is to create a healthy relationship between your food, mind, and your body. The second one is Overcome Emotional Eating and Binge Eating Workshop. So if you can't do the 12-week program, they have a one-day workshop that basically covers the same topics. There's also a weight loss group therapy that is headed by a woman who actually went to school locally. She went to St. Thomas University. She's a psychotherapist, and it's also provided in English, Spanish, and Portuguese. It has more of the therapy of why you're acting the way you are and why you're responding to food the way that you are. There's also support groups for children. The most common one is the Texas Children's Hospital Center for Childhood Obesity. They have different programs like On the Way. On the Way group is a program for school-age children in Southeast Houston. And it's in the late afternoons. It's a 15-week program, and it addresses behavior changes as well as emotions and self-esteem. The Saturday Wellness Program is a quarterly session to teach children about healthy lifestyles and nutrition. And then there's Camp Ka'ana, and it's a 2-week residential camp for children of between 10 to 14 years of age who are struggling with obesity, and they learn how to cope with their obesity and how to fix their obesity at camp. This is the BMI chart that was discussed earlier as well. This is an easier tool to utilize for the actual patient. You find your weight and your height and you match it up, and that's your BMI. So 18 to 25 is normal, and that's the target for rehabilitation. Different places that have rehab, like weight loss programs, primarily it's encouraged that you go to a dietitian or a nutritionist, and they can help you with the whole lifestyle change and how to eat healthier. But there's also Weight Watchers, which is a point system. There's Quick Weight Loss, Nutrisystem, which has a whole line of food, as well as Jenny Craig. It just depends on the person and what works for them. Some patients like a point system so they can monitor themselves. Some people like to go to meetings so they are held accountable. And other people just like a menu completely structured for them so they can follow a menu and they don't have to do much more of the thinking part of it. And that's our presentation.